Right now, in America, if you are an individual trying to get health care, you have to pay an extraordinary premium because you don't bring any market share clout to the negotiating table. And right now in America, if you are a small business, you don't get a good deal because you don't bring any market clout to the negotiation. So this health care bill, at its heart, addresses this problem. It creates an exchange where you would go and purchase health care not as an individual, but as a group of hundreds of thousands of fellow citizens. And that health care plan would bring the combined negotiating clout of those hundreds of thousands or even millions of individuals so that you get a much better deal as an individual and you get a much better deal as a small business. And I know that every individual and small business in America who has gone through this process of trying to get a fair, decent health care plan knows exactly what I'm talking about. And that's the heart of this reform. So when the opponents of reform try to scare you and say we don't need to change anything, just remember how scary their plan is. And I know that you understand what I'm talking about because you see it every day. The opponents are saying it's okay if insurance companies routinely deny necessary medical care and cancel policies in order to increase their profits. The opponents are saying they prefer an America where parents will lie awake at night, worried if they can afford health care their children need because they don't have health insurance for their children. The opponents want an America where a worker is just one pink slip away from losing their job and their health care. That's a double calamity that strikes millions of families in America every year. The opponents are arguing for an America where a would-be entrepreneur who's worked hard and wants to open a business may not do so because he or she can't afford health coverage in a volatile, expensive, small business market. The opponents want an America where small businesses who do offer insurance are faced with double-digit, budget-straining premiums that strengthen the economic viability of that small business. I want to see our small businesses thrive. Our small businesses are incredibly creative, far more patents per capita than large businesses. Our small businesses expand and grow and absorb more workers. We want them to thrive, and a major challenge they have today in thriving is our broken healthcare system.